Diabetes, the Effects on Health by Maggie Brown. Abstract. Diabetes mellitus affects more than 29.1 million people in the United States, most commonly as type 1 or type 2 diabetes. Diabetes can affect a person without them ever knowing. Most of the time, there are several common signs and symptoms the person experiences. When someone experiences these signs or symptoms, or believe they may have diabetes, there are several tests that can be performed through blood work to test for diabetes. There are 3 types of diabetes: type 1, type 2, and gestational diabetes. All 3 of them are caused by different things, but can be linked due to the same factors. Diabetes can be treated by insulin injections as well as oral medications and changes in lifestyle. Diabetes is manageable, and with the right medications and care team, it can lead to a long, healthy life. According to the CDC in 2014, an estimated 29.1 million people have diabetes, and 8.1 million people have diabetes that has been undiagnosed. Although there are several types of diabetes, they are all similar in the way they affect the body. Diabetes is when the body is unable to produce insulin sufficiently, which causes the body to have elevated levels of glucose in the blood as well as urine. Diabetes can be treated in several different ways, such as exercise and diet, daily medications, and insulin injections. Though diabetes is treatable, it can be fatal if not treated correctly and managed daily. Often when people are diagnosed with diabetes, they have no signs or symptoms, but there are some common signs and symptoms with type 1 and type 2. Some of these include increased thirst, frequent urination, unexplained weight loss, slow healing of wounds, frequent infections such as gum or skin infections, and vaginal infections. With gestational diabetes, it is more common to have no signs or symptoms. Gestational diabetes is diagnosed with blood work done during pregnancy. If signs and symptoms are present, they are usually the same as type 1 or type 2. Gestational diabetes often calls for nutrition counseling and diet plans to ensure safety of the unborn child throughout pregnancy. There are several tests that can be done to test for diabetes. 4 of the most common include A1C, FPG or fasting plasma glucose, OGTT or oral glucose tolerance test, and RPG, random plasma glucose test. For A1C to be considered normal, it has to be below 5.7. If the test comes back anywhere from 5.8 to 6.4, it is considered prediabetes, and above 6.5 is classified as diabetes. When someone has what is called prediabetes, it is a chance to make lifestyle changes to improve health in order to avoid getting diabetes. Sometimes diet and exercise isn't enough, and people may have to take a low dose of medication or insulin injections for a short time. With the FPG, 99 or below is normal. 100 to 125 would be considered prediabetes, and 126 would be considered diabetes. OGTT is normal at 139 or below. Prediabetes would be anywhere from 140 to 199, and anywhere from 200 or above is diabetes. Each type of diabetes has a different cause. Type 1 diabetes is caused due to an injured or poorly functioning pancreas. Over time, the body is fighting an infection and attacks the insulin-producing beta cells and destroys them. This affects the way the pancreas produces insulin, thus why daily injections of insulin are necessary. Type 1 diabetes can also be caused due to genetic and environmental factors. Type 2 diabetes is caused by many factors, but the most common is lifestyle. Being obese and inactive puts thousands of Americans at risk for developing diabetes. Also, having extra weight can contribute to becoming insulin resistant, which is very common in those who have type 2 diabetes. Certain genes and family history can predispose people to type 1 and type 2 diabetes. Gestational diabetes can also be caused by genetic and lifestyle factors, but also can be caused by hormonal changes during pregnancy due to the placenta. Extra weight can also contribute to gestational diabetes. Although having gestational diabetes does not mean the baby will have diabetes when born, it puts them at an increased risk for developing diabetes later in life. Diabetes is treated with medications, but also other aspects. Lifestyle changes that can treat diabetes include nutrition and physical activity. The goal of diabetic treatment is aimed to control blood glucose levels and prevent complications. Insulin is the most common type a medication used to treat type 1 diabetes and is also used in treating type 2. There are 5 kinds of insulin: short-acting insulin, rapid-acting insulin, intermediate-acting insulin, long-acting insulin, and combination insulin. Most of the time, oral medications are used to treat type 2 diabetes. Alpha-glucoside inhibitors, bugonides, dopamine agonists, and megalotinides are common medications used to treat type 2 diabetes. All of these treatments are vital to keep those with diabetes healthy and to live a longer life. Diabetes can be deadly. If not treated or medications are not taken as directed, people who suffer from diabetes can go into a diabetic coma due to extremely high blood sugar levels. Also, people with diabetes are more likely to have kidney and heart disease. According to the Center for Disease Control and Prevention, diabetes is the 7th most common cause of death in the United States. There is no statistical fact on how long the lifespan of those who suffer from diabetes. The better the diabetes is managed and controlled, the more likely living a healthy or longer life. Diabetes is a widespread disease that affects millions of Americans. It is very treatable and manageable. Sometimes when people have diabetes, they don't know until they become sick. They often don't have any signs or symptoms, which causes them to remain undiagnosed. Injectable insulin is used to treat most types of type 1 diabetics and can be used as type 2 as well. Most of the time, type 2 is treated with oral medications. Diabetes is caused from several different factors, including injured pancreas, insulin rejection, or hormonal changes due to pregnancy. Diabetes can be fatal if left undiagnosed and untreated, but with the right treatment plan and medications, diabetics can live a long, healthy life.